Don't ignore the dangers of sleep apnea. Did you know that you could have sleep apnea and not even know it? That's right, many people who suffer from this potentially dangerous sleep disorder are completely unaware that they have it. In fact, it's estimated that up to 80% of people with moderate to severe sleep apnea are undiagnosed. If left untreated, sleep apnea can increase your risk of developing other health problems, such as high blood pressure, heart disease, and stroke. So it's important to recognize the symptoms and seek treatment if you suspect that you may have sleep apnea. Early recognition of sleep apnea. Early recognition of sleep apnea is crucial for preventing serious complications. If you experience any of the symptoms of sleep apnea, such as loud snoring, choking, or gasping during sleep, daytime fatigue or sleepiness, or morning headaches, it's important to seek medical attention. What are the causes of sleep apnea? The interruptions in breathing during sleep are caused by certain mechanical and structural problems in the airway. These problems can arise when the throat muscles and tongue relax during sleep and partially block the opening of the airway, when the muscles of the soft palate and uvula sag and block the airway, or when excess tissue in the airway due to obesity causes narrowing. Despite the person's efforts to breathe, a narrowed airway can prevent easy airflow through the nose or mouth. Who is at risk for sleep apnea? Sleep apnea can affect anyone, but certain factors can increase the risk. These include being male, over 40 years old, having a family history of the condition, and having a large neck circumference. Obesity is also a major risk factor. Evidence suggests a genetic basis for sleep apnea, as it runs in some families. Those most at risk of developing sleep apnea include those who snore loudly, are overweight, have high blood pressure, or have physical abnormalities in the nose, throat, or upper airway. Alcohol and sleeping pills can worsen sleep apnea by increasing the frequency and duration of breathing pauses. What are the symptoms of sleep apnea? During sleep, both forms of sleep apnea can cause multiple pauses in breathing, known as apneic events, with some individuals experiencing 20 to 30 or more events per hour. Snoring may also occur between these events, although not all individuals who snore have sleep apnea. Sleep apnea may result in a choking sensation, and when breathing resumes, a loud snort or gasp may be heard. These disruptions to deep, restorative sleep often lead to headaches and excessive daytime sleepiness, as well as symptoms such as dry mouth or sore throat and difficulty with concentration. How is sleep apnea diagnosed? If you suspect you have sleep apnea, your doctor may recommend a sleep study. This involves spending a night at a sleep center where you'll be monitored while you sleep. The results of the sleep study can help diagnose the severity of sleep apnea and determine the appropriate treatment. How is sleep apnea treated? Treatment for sleep apnea is determined by a healthcare provider based on factors such as age, health, severity of the disease, and patient preference. Medicines are generally not effective, but behavioral changes like avoiding alcohol, tobacco, and sleeping pills, losing weight, and using pillows or devices to help sleep in a side position can be effective. Physical or mechanical therapy options like nasal continuous positive airway pressure, CPAP, or dental appliances may also be used. In severe cases, surgery to remove excess tissue in the airway, correct structural deformities, or treat obesity may be recommended. Sleep apnea is a sleep disorder that affects millions of people worldwide, causing breathing to stop and start repeatedly during sleep. Various risk factors such as being overweight or obese, having a large neck circumference, smoking, and having a family history of the condition can increase the likelihood of developing sleep apnea. Symptoms of sleep apnea include loud snoring, choking or gasping during sleep, daytime fatigue or sleepiness, and morning headaches. Treatment options for sleep apnea may involve lifestyle changes such as weight loss and avoiding alcohol and sleeping pills, the use of a CPAP machine or surgery to correct anatomical abnormalities. It's important to seek medical attention if you suspect you have sleep apnea, as leaving the condition untreated can increase the risk of developing other health problems, such as high blood pressure, heart disease, and stroke. Don't ignore the dangers of sleep apnea. If you suspect you may have sleep apnea, it's important to seek medical attention. Taking action now can help you get a better night's sleep and prevent serious complications. What steps will you take to improve your sleep habits and reduce the risk of developing sleep apnea? Let us know in the comments below. Don't forget to like and subscribe to our channel for more informative content.